Hi, my name is Samantha Thibodeau, and the disease I chose was Mycobacterium tuberculosis. So, an overview of the bacteria: it's a member of the genus Mycobacterium. It has a slender rod shape. It requires oxygen, so it's an anaerobic species. Its cell walls are composed of waxy lipids called mycolic acids, and these help the bacteria survive in dry conditions for a long period of time. It's resistant to weak disinfectants and water-based chemicals. With gram staining, results turn out weak, so you usually have to use acid-fast staining for this bacteria. How it's transmitted. So you usually contract the disease through inhalation of respiratory droplets, and you can get those from the sneezing, coughing, talking, singing of an infected person, so any way that they breathe on you. And it is mostly spread by adults who had latent tuberculosis that has become active, and it's usually spread to the people around them. How does it infect the body? So as the bacteria goes through your respiratory tract, in your throat, there are mucuses that can attach to the bacteria and drain it out, but most of the time it usually does reach the alveoli of your lungs, and once it gets to that phase, they send macrophages to phagocytize, which phagocytize is a type of endocytosis. So the macrophages basically engulf the bacteria, and once that happens, they release lysosomes to break down the bacteria. But with TB, they have protein inhibitors for lysosomes. So within the macrophages, the tuberculosis bacteria is not broken down and tend to start to replicate within it. And also, if a person who is infected with tuberculosis at this phase would usually be experiencing a mild fever. And then, so continue with how it affects your body. Next kicks in a cell-mediated immunity. So they send in enzymes to basically close off the macrophages, so basically put a wall around it, and this is called a caseous necrosis. And then within that caseous necrosis, it turns dead cells and tissues into like a cheese-like consistency. Most of the time, your immune system is able to kill off the bacteria, or at least keep it dormant in these caseous necrosis. But if your immune system does become compromised, then the bacteria turns into active and flows into the upper lobes of your lungs. Also, once after this, it can also spread to other organs inside your body, and that is why the disease is very deadly at times. Some of the symptoms, if you do contract tuberculosis, is coughing that lasts 3 weeks or more, coughing up blood, chest pain, pain when you're breathing, fatigue, unintentional weight loss, loss of appetite, night sweats, chills. Who's most likely to contract tuberculosis? Weak immune systems. So it is said that people with HIV have a high risk of contracting tuberculosis. Diabetes, cancer, some cancer treatments can make it easy for you to contract the disease. Malnutrition, age, so most likely kids are most likely to contract TB. If you use illicit drugs, use tobacco, or if you are in poverty and don't get the medical care that you need. Some locations, so it's found in Africa, Eastern Europe, Asia, Russia, Latin America, and the Caribbean islands. Where you live and work also has an effect. So if you work in like healthcare, obviously you'd be working with patients with tuberculosis, so you can contract it yourself. Living or working in like a residential care facility, so a nursing home or a prison, you can contract the disease. Living or immigrating from a country that is known to have tuberculosis, or living with someone infected by it, you are likely to contract it as well. Some of the treatments, okay, so when you go to the doctor and they notice that maybe you can have tuberculosis, most of the time the first step is a tuberculin skin test. And with this, they inject tuberculin into the dermis of your skin, and within 48 to 72 hours, if there is a small localized reaction, that means you were exposed to the disease. Now, the test doesn't always diagnose correctly, so if you do have a reaction, the next step is to take blood test to make sure you truly do have the disease. There are two types of tuberculosis, latent and active. With latent tuberculosis, it's usually treated with a single drug for about 9 months. And then for active, it's treated with a combination of antibiotics for 6 to 9 months at the same time. Prevention plan. So if you are infected with active tuberculosis, it's recommended that you stay home, you ventilate the room that you are in most of the time, and cover your mouth when people are around, or in public wear a mask. If you have tuberculosis and you are being treated for it, please finish your treatment. If you skip dosages, or if you're feeling better and you think you don't need to use the drug anymore, sometimes the bacteria that is still there can become immune to the antibiotics. So then, and then also some countries that are common for tuberculosis have vaccinations, but the US does not